Okay, so first we're going to be checking motion palpation for occiput. First, I want to assess for any edema above or below the occipital ridge. So I find the occipital ridge, I palpate for edema, and if it's an occipital issue, then I would have edema above the ridge. Next, I'm going to be going into motion palpation for this. So I place my hands in a grip like this. I laterally flex the patient's head, and I do a jaw jut movement on both sides. Good. So I would feel for restricted movement on one of the sides. The side that has more restricted movement would indicate the side, and that would either indicate a PSLS or a PSRS. If I wanted to get the third part of the listing, I would need x-rays for that. So next for SI joint, I'm going to have you stand up for me, please. First, I want to check for edema around the PSIS, so I'm going to be contacting around your waistband, okay? So first, find PSIS. Feel for any edema on the inside or below the PSIS. That could indicate a PI or an INEX component. Next, I want to assess the glute folds. So it's okay if I go up towards your glute folds?
Yep.
Okay. So I'm just going to be contacting around the hamstrings. So they slide up to feel for asymmetry in height. If it was a lower glute fold, that would indicate PI. Higher glute fold would indicate AS. I could also have her walk or watch her gait, and to assess for toe in and toe out. A toe in could indicate an EX, and a toe out position could indicate an IN. Next, I'm going to be doing my 8-point check. So I find PSIS, go to S2 tubercle. You lift this leg up, the other one. And I would go down assessing upper and lower boot one more time on that side. Next, we'll go over to the right side, this side, and assess upper boot. So I'm feeling for any restricted movement where one thumb does not go. And next, I could check the patient prone. So while checking her prone, I could assess leg length discrepancy. A short leg would indicate PI. A longer leg would indicate AS. Next, while she's prone, I could check the glute musculature. If it's more pronounced on one side, that can indicate EX. If it's more flat on one side, that can indicate an IN. Okay, so next I'm going to be assessing the right knee to see if there's an issue there. First, what I want to do is just to assess the knee, looking for any abnormalities. Next, I would want to do a popliteus muscle test. So I would have the patient bring their leg up and in like that. I'm going to be pulling your foot out, don't let me. So a positive test would indicate if there's a weak relative muscle test for the popliteus. Then I would go into checking tibial rotation. So first I would come up here, hold, and I would rotate the tibia. If there's any discrepancies there, if the tibia wouldn't want to come out, that would indicate a stuck internally rotated tibia, and vice versa, that would be an externally rotated tibia. Next, I would reassess the relative muscle test. If it strengthened, it would cleared. If it was weak still, then I would check a posterior tibia, and I would perform that move as well.